So today's topic is polycystic ovarian syndrome. As the word indicates, polycystic. Poly means multiple, cystic means cyst, ovarian means ovaries are involved, and syndrome is disease. Means multiple cystic disease occurs in ovaries of the female patient. So that is known as polycystic ovarian syndrome. Now, as you can see, it is most common endocrine disorder. It is endocrine disorder and occurs in 80% of women most commonly because ovaries are more prone to develop cyst, and when cyst develops in the ovary, patient is known as polycystic ovarian syndrome. It is an ovulatory subfertility syndrome. In this condition, patient complains of loss of ovulation. There is no ovulation and there is subfertility occurs, means patient is unable to conceive the baby. There is no fertility occur in the baby. Reproduction is inhibited in this polycystic ovarian syndrome. There is hyperandrogenism. As we know that androgens are testosterone and estrogen. In this condition, there is hyperandrogenism, means increased androgens in the uh, blood of the patient. So patient will have hyperprogesterone, increase in level of progesterone in the blood, that is known as hyperandrogenism, and it also increase risk for development of type 2 diabetes mellitus. In this patient, there is type 2 diabetes mellitus more commonly present, that is known as polycystic ovarian syndrome. Now, clinical features for polycystic ovarian syndrome are amenorrhea. Patient will have loss of menstruation or absence of menstruation, that is known as amenorrhea, or there is subfertility, means decreased fertility and decreased reproduction of the patient. Hirsutism, excessive abnormal facial growth over hand, face, body, and different parts of limbs. So patient will have hirsutism, excessive hair growth will be there. There is also obesity in the patient. Patient will have obese, BMI increased, and acanthosis nigricans, means excessive pigmentation in the patient, and that is increased pigmentation in the body and face of the patient. So these are the clinical features of polycystic ovarian syndrome, and uh, the diagnosis or the laboratory investigation for polycystic ovarian syndrome is testosterone level. As we discussed that this condition causes hyperandrogenism, means increased androgens, increased testosterone level will be there in the blood of the patient, and there is decreased sex hormone or sex hormone binding globulins will be decreased. So in laboratory test, blood will reveal increased testosterone, decreased sex hormone binding globulins, and elevated LH will be there. Luteinizing hormone will be elevated in the patient, and elevated FSH and elevated insulin as well. That's why it causes secondary diabetes mellitus type 2, because insulin is elevated. Now, these are the laboratory investigations which suggest that patient might have or polycystic ovarian syndrome, and ultrasound is also mandatory in the patient of polycystic ovarian syndromes. Ultrasound can also help in order to rule out any cystic appearance in ovaries of the patient. So we can treat according to these clinical features. We have to give combined oral contraceptive pills to the patient, clomiphene citrate to the patient in order to reduce androgens, and metformins because patient develops diabetes. So metformin is given in order to prevent excessive glucose, and there should be exercise prescription to the patient. Patient should be advised to exercise to reduce obesity, reduce excessive fat of the body, and weight loss should be also suggested to the patient. In order to treat hirsutism of the patient, patient should be advised cyproterone gel or GnRH, gonadotropin releasing hormone agonist, and surgical lasers and electrolysis should also be advised to the patient in order to remove excessive hairs on the body. So in this way, patient of polycystic ovarian syndrome is treated, and a patient can be cured from polycystic ovarian syndrome. As we discussed, The brief review of the polycystic ovarian syndrome: patient develops multiple cysts in the ovaries, and those multiple cysts creates problem like amenorrhea, infertility, hirsutism, obesity. Acanthosis nigricans means increased pigmentation to the patient, and there is increased risk of diabetes mellitus in the patient. So treatment should be given according to these clinical features like combined oral contraceptive pills, metformin, and weight reduction can help in the patient of polycystic ovarian syndrome.